From Jordan Valley Medical Centre, and we're talking about a very different way to treat wounds with oxygen therapy. Welcome to the show.
Thanks so much.
All right, let's get started with what is oxygen therapy to begin with?
So specifically it's called hyperbaric oxygen therapy, which is basically oxygen administered under really high pressure.
What does it do?
So what it does, a lot of people have chronic wounds that last for years, sometimes months. Oftentimes they could even lose, toes or feet or anything like that. So it's quite scary.
Okay, give us a visual picture of what that tank looks like. We actually were talking off camera, and so tell us what you answered to me.
Right, so basically you have somebody on a gurney, and you roll them into a clear cylinder. So it's kind of like being an MRI, but you can see out of it, so it's not really claustrophobic. Okay,
well you said it was a little bit like the photoshopped Michael Jackson bed that was covered in oxygen as well. How important is it when you're doing these type of treatments that it is in an area that is secure and safe for the patient?
It's really important because we're dealing with 100% oxygen, so we have them in that chamber, and then we take that chamber to the equivalent of 30 to 40 feet under seawater, so a lot of pressure, and to flood that whole thing with a lot of oxygen, so it's very flammable. We have a lot of safety concerns that we have, and we keep everything really straight. Otherwise, we have so many in place that we don't really have any.
Okay, what are some of the illnesses or wounds? So let's start with the wounds to begin with rather than illnesses that you treat most commonly.
So for hyperbaric, it's very specific types of wounds. So diabetic foot wound that is quite deep, Wagner grade 3 we call it. We also have radiation injury. People who had radiation done years ago often will have wounds come back up or bleeding from like prostate cancer, radiation therapy or bladder therapy or anything like that.
Wow.
Yeah, so it's really the only thing, it's a way to provide oxygen to the tissues that you normally couldn't have.
So does that come under the illness banner as well?
As far as the radiation?
Like if you were to have a flu or a cold, can you...
Good, yeah, that's a good thought, yeah. That's what they thought years ago, and they would try hyperbaric for everything. That's why hyperbaric kind of gets a bad rap sometimes because we're using it for things we aren't. So Medicare will pay for certain very specific things, and so that's what we treat at our center. So colds, things like that, hasn't been shown helpful enough yet.
What are some of the benefits?
So the benefits are, with oxygen, like radiation injured tissue, it doesn't work as well. So you get, not only is oxygen covering all the red blood cells, but it's actually in the plasma, in the fluid that the cells are bathed in. So you get oxygen to areas that even a red blood cell can't get to.
Fascinating, fascinating. How do people get hold of you?
So they can go on the website. Jordan Valley has their own website, and you can look under services and find wound care and hyperbaric.
I love it. I think it's a fascinating service that you're providing. Thank you so much for sharing that with us. Nadia, back to you.